Hi, good evening. Welcome back to my YouTube channel. So I'm Dr. Monica Bartoli, and this is part 3 of my Trauma of Healthcare series. So welcome back. If you haven't taken the time to look at part 1 and part 2, where I talk about the trauma of healthcare for doctors and patients, I encourage you to stop this video and go back and watch part 1 and part 2. That way you can understand where we're coming from. So I've been thinking about this conclusion for a little bit, and I've taken notes and wrote things down as they came to me. And I really tried my best to streamline my thoughts and try to organize them. But there's so much to talk about, so bear with me. And my goal of this talk, since we've already talked about the trauma that healthcare and the healthcare industry brings on doctors, and how that impacts patients. And then we've talked about the trauma of patients and how that bleeds into their experience with doctors. I want to try to make this video more of a conversation, more of a discussion of, okay, so where do we go from here? You have burnt out doctors, traumatized by their healthcare industry, not doing the work that they signed up to do, not feeling like they're doing meaningful work, getting stressed out and letting that bleed into their care of their patients. And you have patients who are so done with being treated like they don't matter, or being spoken down to, or just being frustrated. And we're continuing to be frustrated simultaneously, parallel to each other. So how do we meet in the middle? How do we repair this? I am in no means an expert on this. I can only base my conclusions on my own experiences. So just remember, this is how I have chosen to bridge that gap and improve not just the quality of my life as a physician, but the quality of my patients' lives, as they've expressed to me that what I've been doing has been game-changing for them. So I did take notes again. If I look off the screen or fuss with some papers, it's to help keep me on track, because I could talk about this forever. So let's dive into it. So number 1, and this is for the doctors that are watching and that have been following along. Let me get closer to the mic for this. Take back your profession. It is time that physicians take back their profession. We have allowed other people to make decisions on how we practice. We've allowed insurance companies to dictate this. We've allowed administrators and medical directors. Take back your profession. If you go home every night from the office or from the hospital or wherever else you're practicing medicine and look at yourself in the mirror and think, how did I get here? You need to take it back. Now, that's not always going to be quitting your job and starting your own practice like I did. There's a lot of doctors who need to work in hospitals, right? Otherwise, what are patients going to do? Who don't run their own outpatient clinics, or don't have the skills or the desire to do that. But you can take back your profession and reclaim your power as an employee. Start speaking up, advocating. When administrators come and talk to you, they love to hold seminars on our lunch breaks, especially about physician burnout and teamwork and creating a well-balanced life and all this. So tell them that your life is not balanced and that you are facing burnout. Just say no. Just say no. I have told employers plenty of times before, when they have requested things of me that I felt were not appropriate, or I could not uphold my quality of care and satisfy that requirement, just told them no. You're allowed to say no. Trust me, there's not enough doctors for them to fire everybody. And I'm not telling you to get fired, but I'm just saying it's okay to use your voice. You need to advocate for your patients. You need to advocate for yourself and your quality of life. So take back your profession. Start questioning things. When something makes you uncomfortable and you're doubting that this is something that you should be asked to do as a doctor, say no. At the end of the day, if you make a mistake, administration's not getting sued, your medical director's not getting sued, your corporation, your hospital system, all of a sudden they may get you lawyers, but you're the one in the hot seat. It's your responsibility. So reclaim your power and know that there's doctors out there like me, like you, who know what we're worth. and just say no to the administrative burden. Just say no to the things that are causing you burnout and the things that are not serving you and your patients. The insurance companies aren't going to like it. Administration's not going to like it, but you're going to go home every day knowing that you are doing what you claimed that you were going to do on your first day of medical school. Number 2, this is for doctors and patients. Do your homework. So I talked a lot about trauma for patients being the cost of healthcare, and there's a lot of reasons for it. I'm not blaming any one person, but I can promise you, patients, that it's not because of doctors, okay? Some of us have very wealthy lives and drive Maseratis and live in $1 million homes. I'm not one of them, but that's not most of us. Most of us have children, bills, responsibilities, student loans, and we're not driving around in $300,000 cars. So do your homework. Doctors, make a list of community resources that you can give your patients when they need financial help when it comes to their care. For instance, why don't you contact a local radiology facility and ask them for a self-pay list? That way you have it handy. So when you order the MRI that the insurance denies or the insurance wants the patient to pay $1,000 for, you have an option for them. You're now a partner and saying, I respect your wallet, I respect your money, and you don't need to waste $1,000 on it. You can go down the street without your insurance for $300. Your patients will thank you and appreciate that you find value in them and you care about where they're spending their money. It is your responsibility. Check out GoodRx. I downloaded it on my phone. That way I run every prescription I write for patients through GoodRx. And I tell them, if you're paying more than, $20 for this medicine, stop. Don't use your insurance, use GoodRx. So I hope you get the idea, right? Talk to LabCorp, Quest, ask them for a self-pay sheet. That way you can help patients predict what their medical cost is going to be. And that starts with that partnership, right? If you're willing and able to say, hey, life is expensive. Spend that extra $200 on a nice dinner with your spouse or something you enjoy doing. You don't need to spend that on their medicine. Here's a cheaper way for you to get it. Patients will instantly feel like you care about them because you're showing that you do. And patients, do your homework. Look around for doctors. When you're choosing a physician, I see a lot of people, I think this is a very antiquated way of thinking. A lot of people think if a doctor is a part of a big healthcare system, an educational place, a big corporation that has 1 million locations, they must be the best. And you must be getting the best care because it has some big hospital name on it. And that is not always true. Now, good doctors do work in many different places. And I was an employed doctor in healthcare systems and corporations, and I like to identify as a good doctor. So they are there. But if you're continually being disappointed with your experience, stop going to these big healthcare facilities, stop going to these big corporations, because as fancy and big and their marketing is incredible and they have all this swag they give out, they got to pay that bill somehow, and they pay it by billing your insurance. In turn, not caring about how much money you are spending as a patient and really not caring about how your experience is. You're just another number. You leave and 5 other new patients are coming in tomorrow. It becomes a mill. So if you're tired of that, patients, do your homework. Look up private doctors. Look up direct primary care doctors. You'll find that most of us who own our own practice are invested in our practice. Patients are invested in my practice, right? It is my name on my scrubs. It is my face on my business card. And I want patients to be happy with me. So I care about them. I give them the care that they expect. I give them the respect, the treatment that they expect. And yes, if you go to a direct primary care doctor, you may have to pay them out of pocket. That is essentially how direct primary care works, because we do not play the insurance game and we are not dictated by the insurance companies. So you need to decide if that's something that you can financially do and are willing to invest in your care and your doctor. But even if it's not a direct primary care doctor, go find the little guy. Go find the little guy that owns the tiny little office in the middle of nowhere. And it may not be the fanciest, but I guarantee you'll have a better experience because it is their name on the door and they care about how they treat you. Okay. Sorry, my battery is dying on my phone. All right. So number 3, I'm going to turn my page here. Doctors, share with your patients. Okay. One way that we can heal with our patients and break down those barriers is remember that you are a human who went to school for X amount of years in training in order to take care of other humans. Patients love when I share little personal tidbits with them. And I'm not saying, listen, there has to be boundaries, right? You don't need to get into the intimate details of your home life and all of that. And I'm not telling you to. But little details, patients love when they get an idea of who I am as a person. And sometimes it's prompted. Sometimes patients will ask me. So if they ask you, doctor, where are you from? Or do you have kids? Are you married? Answer them. They just want to get to know you. I'll tell you, I started doing this before I owned my own practice. I made it a habit that every new patient I would see, we'd go through the whole thing, right? Medicines, history, what's your chief complaint, what's going on, the whole visit. And at the end of the visit, I would always look them in the eyes and I would say, well, Mr. and Mrs. whoever, I've learned a lot about you today. I've learned a lot about all your medical stuff, the things you do every day. I've learned so much about you. Do you have any questions for me or about me as a doctor? And patients loved it. They loved it. And that would be their opportunity to ask me, so where'd you meet your husband and whatever it is. And within reason, I answer those questions because I'm a human and we get to share in it. I love when I go to see my patients and they ask me, so how's your husband doing? How are your cats doing? How's your mom doing? It's wonderful. So you don't have to share uncomfortable or intimate details that you don't feel are appropriate or professional. But sharing with patients allows them to open that window of trust. They see you as a human. They feel your guard going down. And it's really wonderful. I love having a personal relationship with my patients. And I love that, we talk about things that we have in common. And that brings us back together the next time we meet and talk. And it makes people more comfortable to open up to you when they know a little bit about you. So don't get offended. Don't roll your eyes. Docs, open up a little bit. Be human. You'll feel like a better doctor and you'll walk out of these experiences feeling really good that you're connecting with people. And the last thing, last bullet point that I wrote down is for the patients. So patients, please stop seeing bad doctors. And I know this sounds really silly, but when you have a bad experience with the doctor, okay, it is crazy to keep going back because you're going to continue to have that. And I do mean this as a real statement. If you continue to go back and they continue to collect from your insurance companies, nothing is going to change. Unfortunately, in this industry, nothing matters until they see their bottom line going down. And how do you stop their bottom line from going down? You stop going, right? If you go to a restaurant and you hated the food, you got food poisoning, the server was rude, the whole experience is a disaster, would you keep going back? No, you would never go back. You would call your friends and say, never go to this restaurant. It was terrible. So why are we doing it with doctors? Patients, I want to empower you. You have a choice in your healthcare, and do not let anybody tell you otherwise. You are not restricted by your insurance to see a doctor. You can have any insurance in the world and see whatever doctor you want. So anybody who tells you you can't, that is not true. I have patients that have insurance. Most of my patients do. They pay for their insurance coverage or they have a primary doctor in network, yet they still choose to pay me $100 a month to be their doctor. And why do you think that is? It's because they are not confined by the rules that they have been told they have with their insurance companies. They have a choice. And so you have a choice. And again, direct primary care may not be the best financial solution for everybody. So find a different doctor in your network. You have choices. So stop reinforcing this bad behavior. You don't have to be aggressive when a doctor offends you or dismisses you. You don't even have to say anything. Just stop giving them your money. Stop letting them claim on your insurance and go somewhere else. Things will start to change when their pockets start hurting. And when the big hospital systems and big administrators see that their bottom line is hurting, that is the only time they're going to stop and say what's going on and what's wrong. So I think if we partner together, doctors and patients, and love on each other a little bit, that we can totally change the game. I do believe that my practice is a game changer for most patients. And I am thrilled that I have put myself as a doctor in that position to be able to change their mind about doctors. I have been so busy these last couple of weeks by the grace of God or the universe or whatever it is that you believe in. I have just had the blessings come. And I will tell you, every single patient I see is so grateful. They don't even care about the money. They are so grateful that I talk to them, that I answer my phone, that they can call me and just say, hey doc, I had a quick question about this. And I love it. My quality of life has gone up because I have nothing but happy patients. And that makes me happy. And I'm not seeing 20 patients a day and my bills are getting paid. So doctors, patients, let's get together. Let's start reinvesting in that relationship and cutting the other guys out. Nothing else matters. When that door closes or that video visit starts, the only people that matter is the doctor and the patient in that room. And we're there to serve. Doctors, you're there to help and to heal and to break down those boundaries. And let's help our patients heal. Let's start showing them that not all of us are corporate machines, that not all of us have an attitude or don't care about them, because we do. And you know what? If an employer gives you crap about it because you're not efficient enough, just tell them you're asking me to do things that I cannot do. And that's simple. And patients, give us another chance. Don't give up on us just yet. I promise you, I'm not the only doctor out there that feels this way. There is a whole community of direct primary care doctors and solo practitioners that we do this because this is what we love, not because we need to get a paycheck every week, and have a steady job to pay our kids' tuition. We took a chance and a risk. Owning your own practice is very scary. So patients, come on over. We will embrace you with open arms and be happy to help with that healing. If you have any questions specifically about direct primary care or solo doctors or how to find a doctor in your area that might be a better fit, let's talk. Drop me a comment, subscribe, shoot me a message on social media. I'm here to help. So I hope you enjoyed this series about trauma and some of my ideas of how we can help each other get over it. I would love to know your ideas if you want to drop them in the comments. And this was fun. Look forward to more series like this in the future, and hit the subscribe button if you want to be notified when I drop more content. Thank you, everybody. Stay happy, stay healthy, and it's almost Halloween. So if you partake in those festivities, have a safe and fun Halloween.